a pre-assessment. We'll ask you lots of questions about your medical health, have a chat with you about what to expect when you come in, and start you thinking about when you're going home and sort of making plans for your discharge as well.
Keep yourself as active as possible, because the stronger you are before you come in, the easier your recovery is going to be. We know that's hard when arthritis is bad, but anything that you can do, whether it's walking up in a swimming pool, whether it's doing the exercises for your knee or your hip, whatever you can do will help you in your recovery afterwards. It's a good chance that you're going to be on crutches for a few weeks after the operation, so think about how you're going to move around the house, and make arrangements for your responsibilities if you can. Move any clutter, any things that might be trip hazards such as low furniture or rugs, things like that. I would try to put anything that you need around waist height so that you don't have to reach up too high or too low for it. Anything to make life easier in these early weeks. Think about how you're going to move things around the house if you need to. Some people have like a mini rucksack or a bum bag to move smaller items around the house. Make sure that you bring loose clothing, things that are easy to put on. Baggy trousers or loose dresses around knee length are perfect. Think about footwear, so either supportive slippers or shoes that are easy to put on and have got a bit of room in them so that if your feet swell, then you're still able to get them on with relative ease.
When you do come in for your operation, they come to the main reception desk, let them know your name, and one of the ward administrators will come down and take you up to your room.
The healthcare assistant normally then comes in, they're wearing green, like a light green, and they'll take your blood pressure and normally fit you for some TED stockings just to prevent you from getting any clots in your legs. The nurse then comes in and will go through the admission.
The nurse go through a lot of paperwork for you. They will tell you what's going to happen from start to finish in terms of the routine for pre and post-op. After the nurse leaves, you might see the pharmacist. The pharmacist will go through your medication. I'm really sorry, there's going to be a lot of repetition because the pharmacist will check your medication again, the nurse would have checked your medication, so it's just for safety precaution to make sure that we capture everything.
The anaesthetist will discuss what type of anaesthetic that you haven't done as well. Sometimes it is a full general anaesthetic, you put to sleep. Other times for some of the hip and knee replacements, you will have what we call a spinal anaesthetic, and they always give you sedation drugs so you are very relaxed. And then other people have local anaesthetics, but the anaesthetist will discuss that and decide between you both which is best for you.
After the anaesthetist, the consultant will also come in. They will go through the procedure, so you need to ask any questions if you still have any. If not, then you're happy to go through the procedure. You sign a consent form.
Getting out of bed, so you need to make sure that you're pain-free first, normally, and that you've had something to eat and drink. So if you've had something to eat and drink and you feel okay, then it'll be okay to get out of bed. Those who have had orthopaedic surgery, we like to just take a blood pressure beforehand if it's your first time, just making sure that it's at a normal level for us to be able to get you up. Physiotherapy will also be able to help you with getting out of bed as well, along with the nurses. Please, I must stress, do not get out of bed by yourself. Always use your call bell.
So the physio will come round the morning after surgery, but if you've had an early morning operation, you might be seen later on that afternoon or evening by the physio. As soon as your physio thinks that you're safe to walk around the ward with your walking aids, then we will encourage you to do so. It's really good for your recovery to walk regularly, good for your circulation and good for your muscle strength as well. After the surgery, it's important that you keep on top of pain relief. That's the key really to getting the best out of your physio and being able to move around as comfortably as you can. So pain relief is important. It's really important that you drink plenty and keep yourself well hydrated, and that you eat as much as you can as well. It's really important that you buzz us when you need to. If you're not feeling confident to do something, it's really important that you ask one of us to be there. It's important that you have somebody around. The key to getting out the bed is to get your bottom to the edge first. So bend your other leg up and move your bottom to the edge of the bed, and then slowly drop your legs around and bring your torso up and around at the same time. To get back on the bed, if you sit down first and then shuffle your bottom as far back as you can, once your leg's supported by the bed, then you can start to step your legs around. We're a lot more relaxed with what you can and can't do after a hip replacement these days, but we do advise that you are sensible and listen to your hip in the first few months. So we advise that you don't force or push your hip into restriction, and that you only move in ways that you feel comfortable. You should move slowly and in ways that you feel that you can control, and try and move in one direction at any one time. So movement tends to come back naturally with time. Don't force it, don't push it, it'll come back when it's ready. The movements that were stiffest before the surgery are the ones that are going to take the longest to come back. So we will give you a helping hand grabber and a long handled shoe horn that you can use to help get yourself dressed. If you need to as well, we will give you a raised toilet seat to help getting on and off the toilet, and also a long handled sponge and an aid to put your socks on and off as well. Yes, it's really normal for legs to be swollen after a hip replacement. This often peaks at about 1 week after surgery, and some people say that their leg looks twice the size of the other one to start with. So to help with this, you can lie on the bed for a couple of periods a day for half an hour to an hour, completely flat. You can pop a couple of pillows under your feet at the end of the bed to help raise, and that can help with swelling. Exercise are really important to regain your movement and strengthen the muscles that support your new hip. Your physio will show you some exercises to do on the ward while you're here. You'll progress those at home, and then we will see you in outpatients a couple of weeks after you've gone home, and we'll progress you as you're ready to. If you have stairs at home, we'll practice these before you go home. If you have a handrail, that always makes life a little bit easier, but we can show you without if you don't have one at home. So we teach you to go up the stairs using your stronger or non-operated leg. So you will step up with your better leg first, then follow with your operated leg, and then the crutch. Coming back down the stairs, we show you to put the crutch down first, followed by your operated leg, and then your better leg. I'd recommend that you sit in the front passenger seat of the car. Get whoever's driving to move the seat as far back as you can in the seat well, and recline the seat back a little bit to give you a little bit more space. You then line yourself up to the car, step your operated leg forward and lower yourself down to sit gently. Once you're sitting, you can then slowly turn around. So most people stay 1 to 2 nights, and you'll go home as soon as you're safe and well enough to do so. As soon as you're medically well and you can get yourself up and about and dressed. We need to know that you're confident and safe to go home, and a lot of it will depend on your setup at home and how well prepared you are. As soon as you are medically well, you're able to get yourself up and dressed and move around comfortably, and the physios are happy, then you'll be able to go home. So So you'll have follow-up physio 2 to 3 weeks after your operation, and that will be at one of the closest Nuffield Health sites to where you live. Rest is just as important as activity in the first few weeks, so it's important that you do little and often. So we advise that you get up and do something active every hour, whether that's a walk or doing your exercises or moving around, and then try to rest in between.